Nagwad dim Lhagi, Llywant dim Plotgwit, dim Adix, Lle Llywant Gwyn, dim Willet in Sagat Gwyn Allach Hatni Duct Gunsa, Ndash Willa Wilch Ach dim Lhagi, Ginamit Lam Sa Gun, Amish Gabish Wanash, Mickey Sa Gimgish, Gis Kledabum, Ndadip Wilch Sa Gimgit As Dim Nidiki, Anadzapki Islam, Ye de Lamakum Ach Hadach, Ash Will Neen Will Ash Hachlakask, Ganstachgat, Ganslamansk, Ashli Wilk Sabach, Amstim Wilt. Amen. So for the agenda this evening, I'd like to begin with a COVID-19 situation update by our Chief Executive Officer of Nisga'a Valley Health Authority, Mrs. Brandi Trudell-Davis. So if I turn it over to Brandi for a Nass situation update.
Thank you, Anthony. I too also wanted to send my deepest condolences to those family members who are mourning the loss of their loved ones this evening. I'm just pulling the agenda up. So Nisga'a Valley Health Authority has received, much different than our last webinar, Nisga'a Valley Health Authority has received laboratory confirmation of 3 positive COVID cases within the Nass. So right now, Nisga'a Valley Health is really focusing on a reduction of risk. So our current actions is we're cross-referencing the high potential risks for transmission with the vulnerable community members list. So we've worked closely with each of the village governments, and they provided list of their vulnerable community members, as well as we have our vulnerable community member client list. And with these, every one of these members were doing telephone check-ins just to assess for symptoms and just a general check-in. And Nisga'a Valley Health Authority continues with the testing as set out on the last webinar. So we are doing it from 2 to 4 p.m., 7 days a week. But community members have to call in to make an appointment, and these are drive-in or walk-up appointments only outside of the facilities, just to provide that infection control. Nisga'a Valley Health is undertaking contact tracing. So what we've done is we have our public health nurse, Sadeed, who will present in a few moments, has received all the names of the 3 contacts, and he is the 3 confirmed cases, and he is working with those confirmed cases to contact trace back whom they've come in contact with for the last week since the period of the 21st to the 28th. Because this has a potential to be large scale, we do have our community health staff. So we have our community health representatives and our home support workers helping the public health nurse on doing these contact tracings. But also, if it becomes overwhelming to our system, Nisga'a Valley Health Authority system, Northern Health Authority has graciously stepped up and has offered the support from their pandemic team as well. So what we're doing is we're really we're reinforcing what we were asking on the last webinar. We're really requesting people to self-monitor. So we're asking people to self-isolate. Anybody who has been in, who is at that high risk, which we talked about last week, attending those services, we're really focusing on self-monitoring. So we want these people to monitor for any of the symptoms of COVID, any flu-like symptoms, fever, sore throat, loss of smell, loss of taste. So basically self-monitoring is just making sure that you're keeping track of you, and parents are keeping track of family members and watching for any symptoms and monitoring on a daily basis, and then communicating in the instant of any symptoms showing up. So these are just the general public. We're expecting the general public just to be monitoring, just being aware of flu-like symptoms, but we're really requesting those high-risk people for transmission to really consciously follow this for the next 14 days. So active daily monitoring will be undertaken now with the confirmed cases. So this is different than self-monitoring. This is actually when a healthcare professional is actually contacting these community members and making sure that they're tracking if they've come into contact with anybody since they've known that they were confirmed cases. Again, checking for signs, symptoms, and then these are signed off on a daily basis by our health professional. That may be the nurse, that may be a Northern Health Authority pandemic team member, that may be our CCHRs or our home support workers. So with that, I'm going to hand it over to Sadeed Habib, who is our public health lead for Nisga'a Valley Health Authority, just to give a bit of an update on the testing. So thank you, and I pass it to you, Sadeed.
Hello, everyone. Thank you, Brandi. So just a quick update on our numbers. As of today, the number tested to date for COVID-19 is 459. Of these, as Brandi mentioned, we have 3 positive. The numbers that have come back negative are 350, and of them, 99 are still pending from the lab. So we are contacting community members for their results as best as we can. Swabs take an average of 2 days to return, but can result up to 7 days in rare cases. As a current estimated incubation period, so I just want to talk a little bit about the COVID itself. The estimated incubation period, which is the times it takes for the virus to multiply in the body, range from 1 to 14 days with a median estimate of 5 to 6 days. Again, like I mentioned on the last town hall meeting, there's that risk for a false negative, which means that you get a negative result, meaning that the result shows you don't have COVID, but in fact that can be false. And one of the things that contributes to that is that the test was done too soon to the exposure. So again, with that, it's the idea of isolating, and that's the best way we can manage the spread on a wide range. So what to do if you think you've been exposed to COVID-19? People with COVID-19 do not always recognize their early symptoms. Even if you do have symptoms now, it is possible to transmit it before you start showing symptoms or without ever developing symptoms. So you need to quarantine or self-isolate for 14 days. If you're returning from travel outside of Canada, that's mandatory quarantine. If you are close contact with someone who has or is suspected of COVID-19, have been told by myself that you have been exposed and need to quarantine and self-isolate. Those 2 terms are interchangeable. So quarantine, what is it? It means it means that for 14 days you need to stay home and monitor yourself, as Brandi mentioned. I recommend a daily journal so you can keep track of symptoms, what develops, when does it start, even if you have no symptoms, to monitor yourself, to avoid contact with other people, to help prevent the spread of virus prior to developing symptoms or at the earliest stage of the illness. And finally, to do your part to prevent the spread of the disease by practicing physical distancing in your home if you start having any symptoms. That is what I have to address today. Thank you.
Anthony, you're on mute.
Sorry. I did click it, but it didn't seem to work that time. Sorry about that. So for the testing, great information, and appreciate the update. We'll move to contact tracing, Nisga'a Valley Health and Northern Health Authority. So we'll begin with Brandi.
I know, now I am on mute. So actually what we were going to do is, I think, Anthony, we may have a different agenda. Is I was going to just get Dr. Penner to do kind of an outline on the testing strategy, and then also the limitation of Nisga'a Valley Health Authority services. Is that okay, Anthony?
That's perfect. I just opened up the latest one I seen. I know there was a couple changes, but I didn't see them. So go right ahead. Dr. Jeremy Penner.
Okay, thank you. So I think a lot of people are aware that over the past weekend, we did a lot of COVID testing, and people who were directly exposed during the recent events, whether they had symptoms or not, and even some of their family members who weren't exposed came in for COVID testing. And the reason is we wanted a wide net of testing to confirm whether or not we had anyone in the valley who tested positive after we knew we had exposures from people who had visited from Vancouver. Now we've confirmed, as Brandi mentioned, there are 3 people who have tested positive in the valley, and we're narrowing our testing strategy now to the people who are direct contacts with symptoms. The reason for that is as Sadeed already mentioned, if someone is a direct contact and they do not have symptoms yet, they could be in the incubation period. So all direct contacts still need to self-isolate for 14 days, even if they don't have symptoms. When we do a test on someone who doesn't have symptoms, the chance of being a false negative is higher. So it means someone without symptoms could have COVID, but the virus just hasn't been reproducing enough for the test to turn positive. Whereas someone who already has symptoms, if they do truly have COVID, then the test is much more accurate. We're gonna find it and be able to confirm it. So for right now, anyone who is a direct contact of any of the visitors from Vancouver or any of the new people who have been confirmed positive, if you do not have symptoms, we still want you to self-isolate for the full 14 days. And if you develop symptoms, then you should call in for getting tested. The public health team will be phoning each of the direct contacts that we've identified from the people who have tested positive in the valley and asking you about whether or not you have symptoms. And if you do have symptoms, they'll be asking you to come for a test. And similar to what we've been doing for testing over the past months, even if you're not aware of any contact, if you have symptoms of cough, cold, flu, then we still want you to be tested for COVID, because we can't always link everything to a direct contact. So even if you didn't attend any recent events and you haven't been in contact with anyone with known COVID, if you do have symptoms, so things like fever, chills, cough, trouble breathing, sore throat, runny nose, loss of sense of smell or taste, muscle aches, those types of things that you would normally get with a cold or flu. If you have any of those symptoms, even if they're mild, we do want you to book an appointment for a test. And then when you get your test results, just to reiterate what Sadeed mentioned, if you have a positive test, then you'll get clear instructions on what to do. If you have a negative test, so it means your test comes back negative, you still need to self-isolate for the full 14 days because because there is a chance that you still have COVID and the test just doesn't detect it yet. And so we'll still be monitoring for symptoms for that full period. Then just to go into the services in Nisga'a Valley Health Authority. So as everybody knows, we have health centers in each community, although the one in Gitwing-Silk is not functioning right now. We don't have capacity to monitor people in those facilities. So we do assessments, we do primary care visits, but anybody who actually needs to stay in a hospital bed has to be transferred to terrace. We also don't have ventilators. So what you've heard on the news, you know, people who get really sick with COVID need extra oxygen and go on ventilators. We don't have those. And those are also in terrace. So for anyone who has known COVID, confirmed COVID, or if we suspect it based on symptoms, if they're mild symptoms, like you're breathing fine, you maybe just have a bit of a sore throat, when we check your oxygen levels, your oxygen is fine. For those people, you'll have the option of staying at home, and we'll just check on your symptoms every day. And if they get any worse, then we'd recommend that we transfer you to terrace. Some people with even mild symptoms, if you have other things that make you at higher risk for getting sick fast, like if you already have a lung condition or a heart condition, and we'll assess for those things, then even with mild symptoms, we'll discuss with you whether you would feel safer being in terrace close to a hospital. Anyone with more severe symptoms, what we'd call either moderate or severe, where you're actually having some trouble breathing, when we check your oxygen levels, the oxygen isn't high enough. For anyone like that, then we would recommend transferring to terrace. And what happens with transferring to terrace is we would send you to Mills Memorial Hospital. We'd speak to the nurses and doctors there first so they'd know you're coming. You'd be assessed at the hospital. And most people wouldn't be really sick enough that you would stay in the hospital. But there is special hotel rooms that are self-contained units that have been designated as quarantine hotel rooms in terrace. So you'd be provided with one of those rooms so that you could stay close to the hospital in case you got sicker, because we know the time it takes to get out of the valley to get to the hospital can be quite long. So just in case someone gets sick quickly, we would want you to be close to the hospital. And during that time, you would we would still be doing what Brandi mentioned of active daily monitoring. So someone would still be calling you every single day to see how your symptoms are. And if you notice you're feeling any worse, whether you're in the valley or in terrace, if you just start to feel any worse at all, then we'd want you to call into the health center and speak to the nurse or doctor so we can decide what the next steps are. I think that covers what I wanted to say, and I'll wait for questions at the end, unless Brandi or the other panelists wanted to add.
Thank you, Dr. Jeremy Penner. Brandi, did you have any supplemental information for who, when, and where?
I just wanted to mention that the transfer to Terrace is quite easy. If it's one of the doctors or nurses that are recommending transferring out to the hotel to be closer to the hospital, that's all mitigated through the patient travel process. So it's not an extra step for any of the community members. It's just, it's triggered through the patient travel. And then the patient travel has connection with EMBC, who is actually the ones through Northern Health Authority. Correct me if I'm wrong, Dr. Kim. They're the ones who actually have the blocked hotel rooms.
Thank you very much. There has been proactive kind of planning to have a hotel for people who might want to or need to stay close to the critical care facilities are. So it's a great we are discussing early, and there are kind of a planning and a kind of program available. Just a kind of quick reassurance to the community members that most of people with the COVID-19 only have a mild symptoms, and they do well and they recover well at home, and that people who need to be hospitalized, usually they don't crush in a day. They start to see the signs over the few days. So with that active daily monitoring, we will able to assess. One of the purpose of that, as kind of mentioned earlier, is to see your progress, how you're doing, and we can arrange appropriate level of care for you. So yeah, just give a bit of reassurance as well as a kind of planning for the care. Thank you.
Thank you, Dr. Kim. So just want to also let the participants know that the Q&A button near the bottom is where you can pose your questions, and we'll be answering questions at the end of the presentations. So just want to let you know that. So we kind of covered a few things with NVHA limitations with the hotel as well as the daily monitoring. Some great information there. Perhaps we can move to overview of health precautions with Dr. Kim and Dr. Penner. So reductions of risk focus.
Thank you. I can start just commenting on so as Dr. Penner and Sadeed very well explained, with a few people who tested positive, and as discussed earlier, some of people tested positive can be a distant infection or active infection. We are taking the precautionary approach, ensuring kind of manage them as cases. And as Sadeed and Dr. Penner very well explained, with those cases, now we are having more focused approach around prioritizing those close contact around that and focusing on testing symptomatic people. That's for the case and contact kind of management components that we are kind of rapidly following up. For the rest of the community, as we discussed at the last town hall meeting too, that we are living in a new norm, that our society and our regular practice in a society already reflect that there is some risk of COVID-19. So for everyone in the community, it's a regular practice that you've been hearing. It's what protect you and protect the community. That's good hand hygiene. Respiratory etiquette, you're coughing, then cover your kind of mouth. And physical distancing, kind of as much as possible, keep 2 meters from the other people, as well as kind of as mentioned many times before, just everybody just do self-monitoring whether they become symptomatic, stay home, contact health center, get assessed and get tested as appropriate, and also do the safe gathering that you stay in a kind of smaller and kind of social group, as Anthony explained very well at the last town about the kind of bubble, as well as in the gathering, ensure to have a good infection prevention control measures, as well as not having too large kind of mass gatherings. And those measures everybody doing that will protect the community.
Thank you very much, Dr. Kim. Dr. Penner, did you have anything else to supplement that?
Just to summarize the key points also from last time. So really the most important things are good hand hygiene, because a lot of times we're getting COVID from what's on our hands and then wiping our face, and cough etiquette. So if you are coughing or sneezing, do that into your elbow. And anyone who has symptoms, as mentioned, don't go out. Self as much as you can and call to get a test. And then we're also asking everybody to use masks regularly. So there's sort of differences in opinion on how important masks are, and the masks, as mentioned in the last webinar, have two purposes. One is they're protecting yourself to some extent if you're around someone who has COVID and coughs or sneezes, but also if you have COVID, they're protecting the people around you. So for Nisga'a Valley, we expect that everybody should have their own cloth or homemade masks hanging by the door. Whenever you're leaving your house, you should take your mask with you. It doesn't mean that you have to wear it when you're out by yourself, but you should have it so that if you're around any other people who are not from within your household, you can put your mask on. Also, before going in any of the public buildings, you should put your mask on. It's a requirement before you enter the health center. You have to be wearing a mask. And this is for the protection of everybody. Also, if you're, really we're saying your household is your bubble. So if you're going visiting someone else's household, you should be wearing a mask, and ask those people you're visiting if they don't mind wearing a mask as well. And if you have visitors over to your house, people who don't live in your household, the same thing. You should put your mask on before they come in and ask them to wear a mask. Now, that's in addition to the hand hygiene and the other precautions. And really, taking these precautions, as I said, it's protecting yourself, but it's also protecting others. So do this to show that you care for the other people around you. This is an important way that we can help each other through this.
Thank you, Dr. Penner. I think this will be a good segue into COVID partnership. So I'd like to now bring forward First Nations Health Authority with Becky Rowe and Dr. Shannon McDonald, Acting Chief Medical Officer, to share some information from them as well. So I think we'll start with Dr. Shannon McDonald, and then we'll go to Becky Rowe.
Good evening, and thank you for having me. Really don't have a whole lot to add. Both Dr. Kim and Dr. Penner have given very, very good information and have been very involved in the response to this situation since the beginning. So I really encourage people to ask the questions. If you're not sure, there's staff at the health center there who are more than willing to assist. First Nations Health Authority, as a partner, is on deck. And if there are any other things that might be needed, if we have contacts that might be helpful and supporting each other getting through this, then that's our job. So I'll let Becky talk about the regional response. I'm right now on Vancouver Island from Sadeed territory. So I'm a little bit of a distance away, but I am available to support as needed.
Thank you, Dr. Shannon. We'll move over to Becky Rowe. Your mic is on mute.
maybe that I have a double mute. Can you hear me now?
Yes.
Beautiful. Thank you so much. Thank you for the warm welcome to all of you in Nisga'a Valley. And again, if you missed it at the beginning, our heartfelt condolences to the community for your recent losses. My name is Becky Rowe, and I'm the new Director for Engagement with First Nations Health Authority. And I join you from the ancestral territory of the Lheidli people here in Prince George. I think Dr. McDonald really briefed you well around the types of supports that First Nations Health Authority is here to support you with. The work that we do when it comes to emergency response, be it a pandemic or a natural hazard, is to work with the local governance, the local experts around the management and support of the disaster response, in this case being the COVID response. There are a few things that we have been working with Northern Health and others around in terms of the delivery of assistance. We have had active engagement in other areas like Haida Gwaii. So one of the things that we can bring to a response such as this one is some very recent experience. I anticipate that there's going to be many questions around supports, around things like isolation supports, how people are going to access mental health and wellness, how people might engage around transportation to access those isolation supports that were referred to earlier. And those are the types of things that the partnership will come together to support Brandi and Anthony and the team around navigating. So I won't go into too many details because it can get quite complex, but know that we're certainly here to stand with you and provide assistance as required. Thank you, Anthony.
Thank you very much, Becky. Always good to be able to reconnect. So next up on the agenda, we have a overview of Nisga'a Government Emergency Preparedness Committee's action plan and recommendations. So based on the information that has been provided, we have had many meetings over the last couple of days since our last town hall meeting. And we have a few recommendations that we would like to share. And first off, in collaboration with Nisga'a Government's Emergency Preparedness Committee and Nisga'a Valley Health Authority, we have implemented the nation's collaborative pandemic plan, which includes the continued 14-day mandatory self-isolation for all that attended the services between the 21st and 25th, the funeral, the memorial, and the feast, and are not experiencing flu-like symptoms. So from August 29th to August 12th is what we are the dates that we are imposing this mandatory 14-day isolation. So as presented by the doctors that we have on the panel today, if symptoms present, there is a mandatory 10-day isolation period or until symptoms are fully resolved, whichever is longer. So the public health contact tracing and active daily monitoring has been identified by contacts, and the drive-up laboratory testing and contact tracing will continue at community health centers between 2 p.m. and 4 p.m. This includes the weekends. We want to ensure that we give ample opportunity for those that wish to receive a test to have an opportunity to do so. So due to infection control measures, all testing is appointment-based and takes place outside the clinic. So dress for the weather if you plan on walking through. Reminder that we wish to remind you that a negative COVID laboratory test does not confirm an individual has not been able to develop the active illness or transmit the virus, and you should still continue to complete your 14-day isolation. We wish to continue to daily self-monitoring for all attendees as well, so monitoring and documenting any health status, and alert the health services if any COVID symptoms start to appear. As we stated in the previous town hall, Nisga'a Government Emergency Preparedness Committee implemented the following steps to protect the nation, to protect our communities, our elders, and our most vulnerable by reverting back to phase 1 of the pandemic plan. So implementing of the travel restriction in and out of the communities, actively monitoring the travel in and out of the community through the established checkpoints that many of you have now been able to experience, and the maintenance of the strict isolation to protect our communities most vulnerable for the 14 days from August 29. Mandatory social distancing in all public areas, offices, and buildings, and the elimination of all social gatherings until further notice. All public access and work areas have clear pandemic protocols that they will be continuing to follow. And as stated many times, and I believe that we still can, sanitization of all areas where the community, where the transmission may have occurred. So the constant cleaning, the constant hand washing. So we understand that there'll be heightened anxiety and potential for social implications. So Nisga'a Valley Health Authority is urging the communities to maintain confidentiality when communicating any potential contact risks. We will not divulge any information from Nisga'a Valley Health, the EPC, or Nisga'a government on specific locations on where potential positive COVID case may be. We are going to treat it as a positive case within the nation. So please understand that we won't be identifying specific locations, whether it's with specific village would be affected. So those are the measures that we are putting in place. And so what does this mean for the nation? We are increasing the autonomy on risking the access to traditional lands. We are working towards increasing enforcement and posed recommendations to Nisga'a government for a short-term local state of emergency. So these are a few of the things that we're working towards with Nisga'a government executive, the Emergency Preparedness Committee, as well as Nisga'a Valley Health Authority. We've also been in contact with EMBC and many other agencies for advice and recommendations that we can work towards. So with that being the overall update, that puts us through a bulk of the agenda. And now I'd like, if there's nothing else further to add from any of the panelists, I think we can move into the questions and try to answer a few of these questions that have been posed to us. So one of the first ones, if you have had a test that returned negative and still have no symptoms after 14 days, is there a reason to do another test? I see a few head shakings as a no, but let's get an official answer. Dr. Kim?
Yeah, thank you. Yeah, so that it's kind of mentioned that the incubation period from the exposure that you might develop the disease is 14 days. So after 14 days, you don't have a symptom, you haven't developed the disease, and your body has to follow up that virus potentially got in your body from that exposure, and no need to, there's no reason to be tested at that point.
Thank you, Dr. Kim. I'd also just like to stress, and it's been mentioned already, that you should still, there's a supplemental question similar to this one posed, that can you also clearly lay out the instructions on the 14-day isolation? It seems to be unclear to many, and now that they have a negative test, that they're leaving and not finishing their isolation. So I just want to, let's give another doctor a chance to answer. Dr. Shannon McDonald?
Sure. there are a couple of reasons for the total 14 days, even if you've had a negative test. I think it was explained a little earlier that there is such a thing as a false negative. So especially if you're early, between the time that you were in contact with the virus and you might become ill, those few days, if you're tested within those days, the test is not sensitive enough to pick that up. So there is a risk that you would get sick within those 14 days, even though you feel fine right now. So we know that, as Dr. Kim said, there's an incubation period for up to 14 days, and that's why the limit is 14 days and you need to stay home.
Thank you very much, Dr. McDonald. So one of the next questions is, after contact, what is considered too early for COVID testing? Let's ask Dr. McDonald.
I was just making hand signals.
Yeah. I know you look like you're answering.
It's about 5 days.
5 days.
Before there's enough virus that's detectable in a test. So anywhere within those 5 days, it's very unlikely that you'd get a positive test, even if you had come in contact with.
Thank
you very much. The next question.
I'll just add to that, and Dr. McDonald can correct me, but if someone has a known contact, but say they develop symptoms after 1 or 2 days, we'd still recommend they get the test when they develop symptoms. It could be that they have faster replicating virus and it'll be positive. It could be that there was another contact earlier that we don't know about. So as soon as someone develops symptoms, we would ask you to call in to schedule for a test.
Right, but the question had been for asymptomatic, but you are correct. If you're symptomatic, you go now.
Thank you both for your answer. Much appreciated. So the next question we have up is, those people who have traveled outside the Northern Health area, so past Prince George, is it mandatory isolation? Is this a requirement for people returning to Nisga'a lands? So I think we'll pose this one to Brandi.
Yes, as part of the Nisga'a Government Emergency Preparedness Emergency Operations Committee, that is one of the not regulations, I don't know how to put it, that is one of the things that we have put in place. So if you are traveling outside the Northern Health Authority area, which is Prince Rupert to Prince George, then we are requesting that there is the self-isolation for the 14 days.
Thank you very much, Brandi. This one has a few segments to it. For exposure, if someone was around a positive case, but only for a few minutes, not 15 minutes, do they need to isolate? Or only if the time was longer? If the time was short, but there was a hug, for example, do they need to isolate? Let's go to Dr. Jeremy Panner.
I'd like to hear from Dr. Kim on this, but I would say if there's a closer, more intimate contact, that we may not need the full 15 minutes of exposure. It would be considered a higher risk exposure if it's a known contact.
Okay, Dr. Kim, do you have any supplemental?
Yeah, it's a really good question, because the reason we ask people to isolate is that if the person is at the high risk of developing the disease, we want that person to be in isolation already, so there is no further transmission from that person if that person developed in case that person developed the disease. What's high risk exposure? There are many different kind of measures. That 15 minutes, 2 meters, face to face without the mask. It's one of a bit of arbitrary measures to say that this is a closer kind of contact. There are different contacts, who the source are and who the contacts are that might be a medical condition. Different type of exposure, like people come to you and write on your face, cupped on your face. Well, that's like 5-second exposure, but that would be kind of different from the other contacts. So I agree with Dr. Panner. It's the 15-minute, 2 meter. That's arbitrary, a bit of a convenient, but as well as a standard measure. But there are different considerations that we will take, and that's why we ask about that context of the exposure. And I will double check with Dr. McDonald on this issue too. Yeah, we have enough doctor to get the full consultation.
Sort of like being a little bit pregnant. If you contact with individuals close enough that you could have touched them, even if you didn't, then there is a risk. So I think that's one of the reasons that the leadership has been very strong about saying anybody that was at the events is probably at some level of risk. And because of that, choices were made about asking people to isolate. But I mean, I'm sitting here sniffling with a runny nose, but there's nobody around me right now. So you're all pretty safe. But when my husband sits down beside me to eat dinner, that might be a little different.
Thank you, all of you. Great answers, and I hope that answers your question. So the next question pertains to the Nass Valley with the mention of masks. Are they also now required in the villages as well? Does anybody want to take that one?
I think, Anthony, that hasn't actually been discussed at the Emergency Preparedness, Emergency Operations Committee, but I think that would be something that the village governments, that's possibly a discussion with the village governments as part of that committee. What are your thoughts on that?
It's a good question, and you're completely right in that we haven't had that come up yet for the villages specifically. If the idea of wearing a mask is if you have any symptoms, it prevents you from spreading it. So partly to answer the question, I think without having discussed it in the Emergency Preparedness Committee level, the best answer I can provide is if you feel more comfortable walking around with a mask within the villages, by all means do so. Just to be sure that you're practicing good mask, what's the word I'm looking for? Proper use of using the mask. So if you have a medical mask that fogs up your glasses, like it's probably not on correctly and is not serving its purpose. And we did answer in the last town hall the difference between the different types of masks, so we won't need to get into that. So the next one is the nation suggesting scaling back the number of people at gatherings, or are we still at a maximum of 50 with social distancing and using masks when less than 2 meters may be unavoidable in passing, for example? So I think I'll move to Brandi to begin this, and we'll see if any of the other doctors have any supplemental information, and then I'll try finish it off. Brandi?
I'd rather defer this one to the doctors and to you, Anthony, as part of the EOC, if that's okay.
Sure. Sadeed, would you be able to comment on this by any chance? I know we haven't heard from yourself, and I didn't want to keep passing over. So if you were able to,
Anthony, if you don't mind repeating the question, because I was fuzzy in the
no
connection.
problem. So is the nation suggesting scaling back the number of people at gatherings, or are we still at a maximum of 50 with social distancing and using masks, where less than 2 people may be unavoidably in passing?
Yeah, because this has not been discussed, so this would be my personal opinion, which would be that anytime we are in an acute phase, which means we've recently had exposures or we've had a large gathering that we have an unknown number of cases that have come up from them, perhaps we could scale back, but then it's something that we could assess and make plans as we go. So for right now, the numbers of pending results that we have, the numbers of negatives that we have, as well as to assess how many community members are symptomatic or asymptomatic. So I think it could possibly depend on that big picture.
Thank you very much. Any of the doctors wish to answer after Brandi?
So thank you, Sadeed, for asking to repeat the question. I felt like it was just me that didn't quite get it. So yes, I am recommending to the Emergency Operations Emergency Preparedness Committee that we do scale it back. It's just really difficult within the nation to keep things that small and to actually accommodate appropriate social distancing with 50 people. So my recommendation from the health authority was that we go back to only family members and household members, so nothing above that. That's pretty much all I have to say about that.
Thank you, Brandi. So from the Emergency Preparedness Committee, we did have a few discussions on gatherings specifically, and we do have a few restrictions that we would be imposing if we got to a state of local emergency, as per the recommendation to Nisga'a Lissam's government's executive. But since we are not at that phase yet, we do plan on putting a restriction on the types of gatherings that occur. So those that have events that need to occur, that we ask that they communicate with the Emergency Preparedness Committee through myself at Nisga'a Lissam's government to provide recommendations and advice on hosting the events that are definitely coming up in the next few days. Okay, next question. Can you clarify, when you say visitors to houses, I am assuming this also means if an aunt goes to visit family, you may be related, but since you don't live in that house, you still wear a mask, correct?
Yeah,
So
I think family is quite broad, but we're really talking about those social bubbles that people have heard about, and as much as practical, we'd consider that households within the valley. So people who live within the same household are pretty much all sharing the risk, and even when we talk about self-isolation in a household, we know that for a lot of people, it would be difficult to self-isolate as an individual, and it may be that the whole household needs to self-isolate. When we're not talking about self-isolation, but just getting on with life in the new normal, then we're saying households is where you're sharing your risk. So when you're visiting someone, who doesn't live in a household, or a family member or friend from another household comes, those would be outside of your bubble. And it's really to try and limit how much COVID can spread when it is in the valley, to try and keep it with as few people as possible.
Thank you, Dr. Penner. Any other answers, or shall we move on to the next question? Let's move on. So we have a sort of a question / comment. So on social media, it was noted that there's 3 active cases in Terrace. So are these cases separate from the Nass Valley? Difficult to, who wants to take this one? If we don't have an answer, we can definitely look into it and answer later on, as we will be getting to the ones that we don't get to answer today.
Anthony, if I may comment on that.
Sure, go ahead, Sadeed.
It's often hard to keep up with what comes out of social media, and there are, we could spend a whole day responding to social media, and it's never ending. So that's why even at the last town hall, my recommendation was for us, yes, to get educated on the BC CDC's website, the Northern Health's website, First Nations Health Authority's website, and so on, but to then also keep in mind that we're in Nisga'a Valley, and that our context is unique to ourselves as well. And although, as you can see, we consult with Northern Health and First Nations Health and so on, we also have to then consider our own context and the decisions that we make with the LISMs and so on. It's very specific to our area. And so there might be certain differences in what you read on our media, our official messages, versus what you might read in other official messages that are also well informed.
Thank you very much. And I completely agree that things found on social media have been difficult to keep up with. A lot of it, I actually try find the source of it, and find that a lot of it doesn't even come from BC, for that matter. So all I can recommend to those that find things on social media is to find it on the trusted sites, the BC Centre of Disease Control, the Ministry of Health sites. There's even things on Nisga'a government page, and I'm sure First Nations Health Authority has many different types of information available as well. So that would be my answer to that. I'm not sure about the cases specifically. So the next question. So going forward, will there be enhanced safety measures and protocols put in place for future cultural events within the valley for those who will need to set up such events, for a recent loss of loved ones, for example? And will the ERS, Emergency Response Services, play a primary role in ensuring the overall safety plans for such events as they are actively happening? So I'll take that, as it mentions my department specifically. And the short answer is I don't think we'll be able to play a primary role. We tried that with the recent events that occurred on the 21st to the 25th. Myself and my staff played a role in trying to mitigate the controls that needed for the memorial, and now all of my staff are in self-isolation because they were at that event. In doing so, they've made themselves unavailable. So in order to preserve their health and safety, my department will be playing a reduced role in actively taking part in events. And we'll take future considerations down the road, but at this point we won't be. That being said, I will be making myself available through Zoom meetings, phone calls, and certain types of meetings where I can provide advice, recommendations to the family on how they can proceed safely, as well as connecting with the village government in ensuring that everything has been followed. So there's quite a bit of questions specifically on dates for the 29th to September 12th. So I'm not sure. Let's look at what was said. I'm not sure where that was, but it is correct for the 14-day from August. Maybe I said August 12th. So August 29th to September 12th is the isolation period from the initial notice that was sent out, and that's 14 days from that point. So yeah, it looks like I did say August 12th. So my apologies for that. Lots of people caught that. So another question. Who and how often are public buildings being monitored to ensure regulations are being met? I think that's a question for the village governments, but we will definitely answer that in the questions when we do set out the questions. The village governments are the ones who have jurisdiction over the buildings within their villages, their respected villages. So they would be in charge of ensuring the regulations are being met. Recommendations are made by myself and my department and other members of the Emergency Preparedness Committee. So another question, and this one pertains to groceries, and I think it'll be a good question for the doctors to answer. Can individuals travel to town and pick up pre-order of groceries from Save On Foods? So they have the online pickup order. So is something like that fine for grocery pickups?
On that kind of question on the kind of isolation, there are people who are isolating from the exposure without the symptoms. For those people, like, we want them to ensure that kind of wear the mask, keep the physical distance, and without having that any interaction with the people or going into the stores, which then you kind of share that kind of space with the people. So there is quite a bit of a contact come into that, but if you can ensure that you don't come into that 2 meters of distance with others and do not expose others, then you can make that kind of visit. If you're symptomatic, then there's an additional kind of precaution. We are more cautious about that you're going into, and usually grocery stores and so on are kind of busier sites. There is a precaution around that. We still try to accommodate that, like you going into the garden, you might want to go into the kind of hiking, that so you can stay physically and mentally kind of healthy. We try to accommodate that, but it really kind of looking into the kind of context and open that's where that social service and so on comes in. So like besides what you need for your kind of physical or mental health, what you need to get out for those grocery and other things. It'd be great to look into the way to support individuals on that isolation, and also checking with Dr. Pennell and Dr. McDonald on this issue too.
I don't know the way the grocery store is, but it may be an idea for individuals who are not isolating in the community, maybe volunteer their car go pick up orders for 2 or 3 other people, so that there are fewer people traveling and potentially making contact. Sorry, excuse me.
I'm good when Dr. McDonald. Bless you. So
I'll just add, because there was another question, and I think Dr. Kim answered it. Another question about if someone's in self-isolation, can they still go out for walks and stuff, or does it mean that self-isolation is staying within the house? And so just to repeat that you know, self-isolation is about you keeping your distance from other people, and you know, the Valley has a lot of places you can do that outside of your home, and certainly it's good for your physical and mental health to get out if you can.
That's great information. So going for walks on the lava beds, there's many people that were doing that during the peak of the spring. So things like that are still good to do. That's great, and I completely encourage all of those who are viewing this today to continue to do that. If you're self-isolating, just for your mental health, and so that you're not getting cabin fever, go out onto the lava beds and go for a walk and enjoy a little bit of nature. I think I scrolled down a bit too far here. So we have a question about a couple was tested at the end of the month and received a negative result because they attended the memorial and the reception at Nisga'a government when the casket arrived. So does this mean they tested for nothing? I'll try to reword that. So a couple received the test at the end of the month. So that would have been 6 days after, maybe even a week after the casket had arrived and from the memorial. So a few days, with 5-6 days after that, they received a test, they received a negative result. Does this mean they tested for nothing? And I'll assume the answer will be no, given the time frame.
I can kind of start by kind of saying that we are taking the precaution. So even if you tested negative, we're taking the precaution because you can still develop the disease in 14 days. Also that we are kind of prioritizing as we kind of learn more about the situation, we are kind of prioritizing, focusing on where we know the risk is and what's the best practice to address that issues. Like hoping to kind of set that kind of clarification a little bit on that, and pass on to the others further answer this question. Thank
you, Dr. Kim. Dr. Penner, do you have anything to add?
Yeah, I'll add that you know, a negative test result, in a way, never provides a definitive answer. So as mentioned, we do have false negative tests. Even people with symptoms, their tests can be negative and they still have COVID. So if to you that means the test was done for nothing, then yeah, it's possible to interpret that way, because we still want you to do the self-isolation irrespective of the test result. So even if it's negative, you still self-isolate. So that negative test result does not affect your management, I think. But you know, I wouldn't consider it that you did the test for nothing, because if it did turn out positive, then it sets a different chain of actions. Then we find out who your direct contacts are within a potential infectious period, and try and identify the cluster of other people who may have been infected. So a negative test result doesn't tell us much, but the test is still important, because if it's positive, that's important information.
Thank you, Dr. Penner. I was just trying to ensure I captured the question right. It sounds like they got tested post attendance of the event. And a friend of mine is just messaging, thinking that they got tested before the event, but I'm not sure it's worded that way. So another one that comes forward is, so what about children and staff returning to work or class? So I think that's a question for the school district. And go ahead, Dr. McDonald.
Just a thought that we've been using to talk about this, that the population in the school reflects the population in the community. And if there is COVID in the community, there might be COVID in the school. But doing the work that your community is doing to reduce the possibility of COVID being in the community means you're also protecting those kids. And when COVID is gone, their risk reduces to almost zero. So it's really important, the work you're doing now, to protect the kids as they go back to school.
Very well articulated. Appreciate that, Dr. McDonald. And also just want to say that we have been, this superintendent of the school district within the Nass Valley is a part of the Emergency Preparedness Committee and has been an active member in our planning process. So they are actively working with a plan that does reflect where the situation we're in right now. So if this current positive case, string of positive cases continues, then the idea is the reopening of the schools will be delayed by a few days or by a week, but it's designed to be able to be flexible like that. So we will be working closely with the school district in ensuring that everything, that the safety of the children and the staff working there are at its maximum before we decide to reopen the schools. So another question posed is geared towards the date of exposure. So should we not isolate from the potential date of exposure and not from the 29th as stated? So if the exposure was, say, the 25th, just throwing a date out there, I read that verbatim. If the date was the 25th, should the 14-day isolation be from the 25th, or should it be from the 29th, as that's the date we found out there was a positive case? We'll start with Brandi.
Because Nisga'a Valley Health Authority had a difficult time in determining when exactly the exposure time was, we picked the 29th as a great time because that's when we officially had confirmation that there were positive tests outside that had traveled through the Nass. So that's why we picked the 29th, because it's going to be really difficult to kind of monitor nationwide, the self-monitoring, if there's a whole bunch of different people doing different times. So Nisga'a Valley Health thought it was proper to pick one date, although it's inconvenient for some community members if, say, they may have been exposed on the 21st. We'd rather err on the side of caution.
Any of the doctors, Penner, McDonald, Kim, or Sadeed, do you have any additional comments, or are you good?
Just my quick comments is that there are measures that implemented at the community level, and there are measures that implemented at the kind of individual level. Like, for example, with those kind of cases found through this kind of testing and a kind of tracing process, like for the individuals connected to that particular case, we look into the context of exposure, and we look into the kind of exposure contact, then we can apply. So we can we can be more refined and detailed approach. For this particular event, it's a community event and community exposure, so it's community measures.
Thank you very much for that. So some of the comments I think are sort of supplemental to their question, and I'll try go back to the specific one. Just give me 1 second. So the initial question was, if you had a test that returned negative and still had no symptoms after 14 days, is there a reason to do another test? So that was the initial question. And then just coming back to it, I think this is supplemental. I'm not sure how that bears on the risk or reason for being 14 days. So having a negative test result, what is the risk or reason for continuing in the 14-day isolation?
So it's again kind of ensuring the safety of yourself as well as the people around you. That ensuring that that 14-day is the period that you might develop the disease from the exposure, and depending on where you're at the course of the disease, and depending so the test may or may not exactly get that. So we like to ensure by continuing to implement that 14-day isolation, just in case you develop the disease, even you are tested, say, too early on that disease course and tested negative, that even if you develop the disease, then you would get kind of report and kind of test it at the same time that people around you are not exposed, so then there is no continued transmission of disease. So it's for your safety and community safety, and we're taking that kind of precautionary approach to ensure that.
Thank you very much. So one of the things, one of the next questions has to do with an APC question, I think. So with people already leaving for the long weekend, why aren't the state of emergency travel restrictions being implemented already? And one of the reasons, I'll start off, and if any of you have any supplemental information, please do so. But we only received, like, from the 29th, we had a positive case that came to the Nass and returned back to Vancouver. It wasn't until yesterday, was it yesterday? Sorry, my week's getting away from me, that we received the notice of the 3 positive cases.
I'm sorry, Anthony, the week is running. I think it might have been Tuesday or Wednesday. Dr.
What
Penner,
day is it today?
can you confirm?
It's Thursday.
It was overnight Wednesday, like, so I mean overnight Tuesday, so Wednesday morning was when we were aware.
So that's when we found out we had the positive cases within the Nass, and it wasn't just a risk at that point because someone came in and then left that wasn't living in the valley here. So the state of local emergency does take time to enact, and one of the things that need to take place is it's either the president and or executive as a whole that approves the state of local emergency in the first place. So the committee, Nisga'a Valley Health Authority, makes the recommendation to executive, presents to them. We also need to connect with EMBC as well as the Solicitor General to ensure that the criteria for activating a state of local emergency or declaring a state of local emergency is valid. we need to connect with them and also have a plan, because with Nisga'a Emergency Program Act, we only have 7 days once the act is enabling for the state of local emergency. And then we have to go back to the Solicitor General to reapply and apply for an extension. So the process just takes a little bit of time, given that this is a health emergency and it's not a typical emergency like a wildfire, tsunami, or a flood. In those instances, the process is typically a little shorter, but that's the reason we haven't done it yet. We actually met with executive recently to make those recommendations, but well, just to cap it off, the process just takes a little longer than we would like. Did I capture that mostly there, Brandi?
Yes, it's quite a difficult process. So it has to go through legal, and it has to go through the Nisga'a listens government legislation. So it's not just something that can be done. It is something that's being worked on, but it does take time.
Thank you. Just going through the questions here. Some of them are repetitive, so I'm just trying to pool them together. So the next question is, I was concerned to see the nation put out a request to those at the funeral, but no mention of the cultural dancers. They were not asked, and as a result, some are and have not gone to be tested or even in isolation. Why is this? Brandi?
This is a complete oversight on the side of the notification. It was not meant to exclude anybody. It was just an oversight on the high risk members.
I think the other part to it, though, as well, is the cultural dancers were there for the arrival of the casket, and the band themselves, the reason they were mentioned is because they were in the building for 3 presentations, even though they were really isolated off to the side, and wearing masks when they weren't playing. The cultural dancers didn't play a part in a large part anyways, in the memorial, nor did they at the feast. And that's those areas, including the house, where the areas of focus I think we were working on. I don't want to get too much more into details with the event itself. I just wanted to clarify about the cultural dancers. So another good question here. So following the 14-day isolation, so should people get retested after 14 days is up, or is it necessary after receiving a negative result and no symptoms?
So I think we've answered this a few times, but it's important enough to repeat that that really it's just if someone develops symptoms. Then we would consider it potentially a new exposure and a new risk, and anyone who has symptoms should come for a test, whether they've been told they have been in a close contact, or even if they don't think they've had any close contact.
Sounds good. A couple of questions I might leave for answering in writing, although maybe I'll pose this to you, Brandi, and maybe for Becky, you can provide information, just different information on it. So has the infected person disclosed who they've had contact with? Names is not necessary for here, but have they disclosed who they've had contact with for tracing purposes?
I think Sadeed is the best one to comment on the contact tracing. Sadeed, do you feel comfortable commenting on this one?
Sadeed, you're on mute if you are answering.
I'm trying.
I wasn't sure.
Do you mind repeating that question?
No problem. So has the infected person disclosed who they've had contact with? So for contact tracing purposes, how would what would be the best answer for this, I think?
How would we notify for the contacts? Is that the question?
Has the infected person disclosed who they have had contact with?
So when we have a positive result, we contact the individual and we ask that they provide us all the contacts that they have been in contact with, physical contact, within 2 meters and so on, in the recent past. And what also I consider with them is how long with surfaces, because you have contact through surfaces indirectly as well. That's not to be overly paranoid, but at the same time, a positive case within the same household, even if they in theory are not in contact, but because the surfaces are frequented enough by the members, let's say, right? Or employees that work together, for example, right? So we receive or I ask for their list of contacts, and then for the upcoming 10 days after that, they are actively monitored. Every day they're called and checked for any changes in their symptoms, as well as those contacts are contacted, but the individual's name is not mentioned to them for confidentiality purposes. If they themselves choose to do so and disclose the positive case to anyone they wish to, then that's up to them.
Thank you very much. There's a few questions. I've been trying to pull them all together so that they're worded so I can answer like 4 or 5 of them at once. So with our current status as level phase 1 of our restart plan, and our sort of safety region, I guess, would be the Northern Health region. Is travel within the Northern Health region restricted? And once returning from Prince George or Prince Rupert, does that individual need to self-isolate? Brandi?
I think, from the discussions and the deliberations at the emergency preparedness, as long as people are within the Northern Health Authority area, my understanding is, Anthony, correct me if I'm wrong, that they do not need to self-isolate at this point. However, there is concerns about Nisga'a members living on the traditional lands that are traveling out. I think that's more of the concern right now than them coming back from the Northern Health Authority region. Anthony, did you have anything to add to that?
I think you covered most of it. The discussions we've had in the Emergency Preparedness Committee meetings is that there is times where travel is necessary for whether it's medical or what have you. And from the discussions that we've had, anything in the Northern Health region, because there's very small pockets of cases here compared to other regions within the province, That was our, lack of a better word right now, safe zone for travel. So yeah, I don't think I have any additional comments, and looking around people's, let's move on. I think that I was able to cover a few answers with that one. Not sure how much longer you guys were willing to go. I know it's 20 to 9, but we're covering off quite a bit of the questions. I'm trying to answer the higher level ones.
Anthony, it's Dr. McDonald. I'm going to have to sign off. It's gotten a little later than I anticipated, so absolutely will remain available for support and questions as needed.
Sounds good. I think given the time, I don't want to keep everybody too late. We do have more questions here that we'll get to through, we have Destiny, who is taking all these questions down, and we'll answer them all in a document. Just one last question. This one I think would be a good one to just to finish off with. What if someone called 811 and they have they're providing different information compared to what our health authority or other information that they're getting?
I think I saw one of the questions related to 811, and it was about you know, calling and having mild symptoms and being told that they don't need to have a test. And I think definitely if anyone in the Valley has symptoms, even if they're mild, we want you to call the health facility, even if it's not the same information from 811, because we are doing tests, and part of it is testing capacity. So in parts of the province, the testing capacity is being overwhelmed, so there may be some prioritization, or people will be told that, you know, they're not able to get a test for several days, whereas in the Valley, because we are making testing a priority at this moment, and we have testing available from 2 p.m. to 4 p.m. every day, including the weekend and including over this long weekend. We do want testing more. The other area where 811 is giving different information is about the length of self-isolation, and that's as Dr. Kim mentioned, when there's a specific contact, then the self-isolation period is always from the date of that specific contact. So if people are calling 811 and saying they're at this event on the 25th, then 811 will give them that 14 days of self-isolation. But as Brandi mentioned, the nation is using the 29th, and that's as an extra precautionary measure, because we don't know how many potential exposures continued after that, particularly now that we have positive cases in the Valley.
Thank you very much for that. So in the interest of time, I think I want to thank everybody for posing your questions. We will endeavor to get all the answers to those questions and get them posted. We are still working on the other questions from the previous town hall as well, so just know that those are all coming out in due time. If we can just go around quickly and just have closing comments from each of you, and then I'd like to ask Bobby Clark to provide final comments and, if possible, a closing prayer. So we'll start with, well, I'll just pick one. Dr. Kim.
Thank you very much. So thank you so much for the invitation to kind of town hall. It's a really great to have this the opportunity to talk with the community directly, and it's great working with the Nisga'a Valley and Nisga'a Valley Health Authority, as well as with the Sadeed and Dr. Panel. So we will continue to work together for this the COVID-19 situation in Nisga'a Valley. And thanks again for the community and community members for rigorous measures that will protect the community. Thank you.
Thank you very much. Let's move to Sadeed.
As a closing, I want to remind the community that we have set up a phone number, which is a dedicated COVID line, 9 to 5. I'll just pull it up just a moment. And it is 250-633-5048. So 9 to 5, we have a dedicated COVID line for questions. And if you want to inform us of any mild symptoms that are coming up, 250-633-5048. Thank you.
Thank you very much. Let's move to Dr. Penner.
Thanks. Thanks for everyone participating in this webinar and for all the great questions, and we'll continue to try answering them. Again, anyone who does feel like they have symptoms of cough, cold, or flu, then call the health center. You can call the line that Sadeed gave, and I'm sure that will be posted on the website as well. And it looks like we don't have any confirmed additional cases at this moment. So, but this is certainly going to happen again in the future. So we have to start getting used to these precautions being part of our daily lives. Thanks.
Thank you very much. Let's move to First Nations Health Authority, Becky Rowe.
Thank you so much, Anthony, and just really want to express my great appreciation for the invitation to join this call tonight, as well as the wisdom of the speakers that were with us today, and also want to really acknowledge the very thoughtful questions that were being posed tonight. Very obviously an incredibly invested community, and just really value the thought that went into each and every one of the questions that came out tonight. And incredibly difficult circumstances, but know that you've got amazing leadership within the Valley, and really looking forward to continue to work in supportive partnership with everyone. So with that, I wish you all a good evening, and look forward to continued partnership with you all. Thank you.
Thank you very much, Becky. One of our panelists, we had troubles getting connected, but I want to see a provider with an opportunity to provide any comments. Coco Miller.
Hi, thank you, Anthony. I really appreciate the opportunity to be included in this town hall meeting, and just wanted to introduce myself. I'm Coco Miller with the First Nations Health Authority based in Terrace. I am the Community Engagement Coordinator assigned to the Nisga'a Nation, and it is my pleasure to provide support to Nisga'a Valley Health Authority, as well as your government partners in NLG and your EOC. For any assistance in coordination, that's my function. So I primarily work with Brandi and her staff in ensuring that anything that's required in order for your membership, essentially we're the ones that are paddling furiously under the waterline, and so that you don't experience any hiccups in providing necessary support. And I just really hold my hands up to the staff in the Valley for their all the work that they've done in being super coordinated well ahead of this event. And I just appreciate the opportunity to serve you in any capacity required. Thank you.
Thank you very much, Coco. I always appreciate having you on board and connecting with us. And I know you do great work with Brandi. And that'd be a good segue into Brandi's final comments.
I'd just like to take this opportunity to thank everybody. Thank you for the thoughtful questions. Thank you to the panel members. I just really do ask again that we are kind to ourselves and to each other during this really difficult time. We're managing an unprecedented situation, so we do again ask for some grace and some patience, and God bless you all. Thank you.
So once again, it's been a pleasure to moderate this town hall, and thank you all for joining. I hope that the information that we provided today will help guide each of you in your daily decisions and keep each of you safe. As we progress through the steps in keeping everybody safe, I hope that this time during the mourning for the grieving families isn't too difficult. I know it will be, but send good prayers and thoughts your way. So I'd like to finish off this evening with Bobby Clark to provide any closing comments and closing in prayer. Bobby.
Thank you, Anthony. Can you hear me okay?
Yes.
Okay, good. As acting CEO for this week, I wanted to provide some closing comments to give some context to the excellent work that you, Anthony, and Brandi have been doing in collaboration with the Nisga'a Emergency Preparedness Committee. Since receiving notification of the potential exposure, which has ultimately resulted in confirmed cases in the Nass. As we all know, this virus has no boundaries, no borders. We are all susceptible to it, and we must all keep that in mind and don't play the blame game, and just be compassionate, be kind, and be loving to one another as we chart through an incredibly difficult path forward. We are all in this together, and that's something that we must never forget. As Anthony has mentioned, the Nisga'a Government Executive has been engaged with the Emergency Program Committee and are seriously considering the best path forward. And undoubtedly there will be many more engagements such as this, where we are keeping our nation informed on a real-time basis. So I want to pay respect and gratitude to the medical professionals that are with us this evening for their knowledge and their wisdom that they're so freely sharing with us, so that we can gauge our path forward. So with that, I will close in the same prayer that Anthony opened with. Let's bow our hearts. Nagwadam timla hagi, lawantam slotquid, the matix lachalkikasquin, the multim sagarkun lachani tuktunsa, and that will a welt at timla hagi, ginamit lam sagum, قبيل ونال ميكي ساكيم كي سزاب أندار بلا ساكيم كي أسد نيكي أنزاب كي إسلام يلام زي هاكون التلتينكم مثلا سبايل كار هاي دلماتكم مثلا تاخ أثنين ولد قن خلقي كسكو قن استحكات قن شلامسكو أختي ويل سابخ دم ويل. Papi O'Malley says amen as well. Have a good evening, everyone.
Have a good evening, everyone. Thank you for joining, and we will endeavor to answer all your questions. Have a good night.